For decades, Assertive Community Treatment, or ACT teams, have provided a key safety net for Mainers struggling with severe mental health issues. These are critical treatment services that allow patients to stay in their communities and out of mental health facilities.
But providers say low reimbursement rates for Maine Care, which is the state's version of Medicaid, are putting some ACT teams in serious financial jeopardy. News Center Maine's Vivian Lee has more from Bangor.
Despite a half a foot of snow piling up outside, Tina Little and Kenneth Chase are getting ready to hit the streets. They are members of the Assertive Community Treatment, or ACT team, operated by Community Health and Counseling Services. They support patients struggling with severe mental health problems. Tina is the team's case manager. She helps patients find housing, food, clothing. They do home visits, take patients to medical appointments, job interviews, and run errands.
The face-to-face and seeing people and meeting them where they're at builds a rapport that then allows the actual work to happen.
Kenneth, who struggled with mental health issues, is in active recovery and knows the importance of human contact. He was on Tina's caseload. Now, 25 years later, as the team's peer support specialist, he helps others facing the same challenges.
It's a gift. By helping others, you help yourself.
Team members also deliver medications dispatched by the agency's in-house pharmacy. A psychiatrist and nurse provide treatment here to about 50 patients within a 25-mile radius. Dale Hamilton is the executive director at CHCS. He says the highly specialized services are becoming unsustainable because reimbursement rates for Maine Care have not kept up with costs.
Not having rates that support our current costs also prevent us from recruiting and retaining staff that are needed for these highly specialized services.
The Tri-County Mental Health Services ACT team, which includes a psychiatric nurse practitioner, supports 100 patients in the Lewiston-Auburn area. Executive Director Catherine Ryder says the program currently is operating 6 figures in the red at a time when waiting lists for mental health beds are sky high.
And there is no other place for them to go. Our state hospitals do not have capacity at this time.
State Representative Colleen Madigan is a licensed social worker who has worked on an ACT team. She sponsored a bill that would increase the Maine Care reimbursement rate by 25%. The bill was carried over from the last legislative session.
My fight is going to be to make sure that these critical mental health services get funded and get in that supplemental budget.
As for Kenneth, helping patients have more productive lives,
It's made me a better person working here. It's made me a better person on the ACT team.
Is key for his ongoing journey of healing. In Bangor, Vivian Lee, News Center, Maine.
The Department of Health and Human Services, meanwhile, has been conducting a rate study to improve the state's mental health system over the long term.
A spokesperson tells News Center Maine that the proposed rate increase would complicate that study and possibly delay reforms. We'll have a full statement from DHHS on our website and News Center Maine mobile app.